Welcome to our video on a topic that's close to the heart and other parts of many men over 60, the changes in male sexuality as we age. Today, we're going to embark on a journey of understanding, acceptance, and empowerment. Did you know that by 2030, 1 in 6 people in the world will be aged 60 or over? That's right. We're part of a growing global community, and it's high time we address the elephant in the room, our changing bodies and sexualities. Now, let me share a personal story. A few years ago, I found myself staring at the mirror, noticing the gray hairs, the wrinkles, and yes, some changes down there too. I felt a mix of emotions, confusion, worry, and a bit of sadness. Was this the end of my sexual life as I knew it? Spoiler alert, it wasn't. But at that moment, I realized how little we talk about these changes, how we often suffer in silence, thinking we're alone in this experience. Let's be clear. Changes in our bodies and our sexual functions are a normal part of aging. Just as our hair grays and our joints might creak a little more, our sexual organs and responses evolve too. It's not a failure or a flaw. It's a natural progression. But here's the good news. Understanding these changes can lead to a richer, more satisfying sexual life than you might have imagined possible. I want you to know that you're not alone in this journey. Millions of men around the world are experiencing similar changes, asking the same questions, and seeking the same answers. This video is for all of us, a guide, a friend, and a source of reliable information to navigate this new phase of life. Our goal today is simple, yet profound. We're going to explore 10 key areas of change in male sexuality after 60. We'll discuss what's happening in your body, why it's happening, and most importantly, what you can do about it. We'll talk about everything from changes in erections and libido to the emotional impact of these shifts and how to communicate with your partner. But this isn't just about problems. It's about possibilities. As we age, we have the opportunity to redefine what sexuality means to us. We can discover new forms of intimacy, deeper connections, and a sense of sexual confidence that comes from truly knowing and accepting ourselves. Throughout this video, we'll be incorporating real stories from men like you. Don't worry, we'll keep everything anonymous. The latest scientific data and insights from experts in the field. We'll use some analogies and even a bit of humor to make these topics easier to understand and discuss. After all, a little laughter can go a long way in making us comfortable with uncomfortable subjects. Now, let's dive into our first topic, changes in erection firmness. As we age, it's common to notice that our erections aren't quite as firm as they used to be. This isn't just your imagination. It's a real physiological change. The blood vessels that supply blood to the penis can become less efficient over time, and the smooth muscle tissue in the penis may decrease. Think of your penis like a balloon. When you're younger, it's a new, stretchy balloon that inflates quickly and easily. As you age, it's more like a balloon that's been inflated many times. It might take a bit more effort to inflate, and it might not get quite as firm. This doesn't mean the balloon doesn't work. It just works differently. Several factors can influence these changes. Health conditions like diabetes, high blood pressure, or heart disease can affect blood flow. Certain medications, particularly those for blood pressure or depression, can impact erectile function. Lifestyle factors like smoking, excessive alcohol, consumption, or lack of exercise can also play a role. But don't despair, there are many solutions available. Medical options like Viagra, Cialis, or similar medications can help improve blood flow to the penis. These aren't just for younger men. They can be effective and safe for older men too, under a doctor's supervision. There are also non-medical approaches that can help. Kegel exercises, which strengthen the pelvic floor muscles, can improve erectile function. These exercises involve contracting the muscles you use to stop urination midstream. Try doing sets of 10 to 15 contractions, holding each for 3 to 5 seconds a few times a day. Regular cardiovascular exercise can also help by improving overall blood flow. Even a brisk 30-minute walk each day can make a difference. And don't underestimate the power of a healthy diet. Foods rich in flavonoids, like berries, apples, and green tea, have been shown to reduce the risk of erectile dysfunction. Remember, adapting to these changes doesn't mean giving up on sexual pleasure. It might mean focusing more on foreplay, exploring different types of stimulation, or using aids like cock rings that can help maintain firmness. The key is to be open to new experiences and to communicate with your partner about what feels good. Now, let's move on to our second topic, changes in size and appearance. Many men notice changes in the size or appearance of their penis as they age. This can be concerning, but it's important to understand that some change is normal and doesn't necessarily impact function. As we age, fatty deposits can build up in the arteries, reducing blood flow to the penis. This can make the penis appear smaller. Additionally, a buildup of inelastic collagen in the tunica albuginea, the fibrous sheath surrounding the erectile tissue, can reduce elasticity, potentially leading to a slight reduction in size when erect. It's crucial to understand that these changes are generally minor and don't significantly impact sexual function or pleasure. However, the psychological impact can be substantial. Many men tie their sense of masculinity or sexual prowess to the size of their penis, leading to anxiety or decreased self-esteem when they notice changes. Let's debunk a common myth: the idea that penis size determines sexual satisfaction. Studies have consistently shown that factors like emotional connection, communication, and overall sexual technique are far more important for sexual satisfaction than penis size. Remember, the most sensitive parts of the female genitalia are in the first few inches of the vagina and on the external parts. When it comes to self-care, maintaining overall health is key. Regular exercise, a balanced diet, and avoiding smoking can help maintain good blood flow and general penile health. Grooming can also make a difference in appearance. Trimming pubic hair can make the penis appear larger. For those particularly concerned about size, there are some non-invasive options to consider. Vacuum pumps, when used correctly and under medical supervision, can help improve blood flow and potentially increase size temporarily. However, it's crucial to approach any enhancement methods with caution and skepticism, as many advertised products are ineffective or even harmful. Moving on to our third topic, changes in libido or sexual desire. It's common for men to experience a gradual decrease in libido as they age. This isn't a universal experience. Some men maintain a strong sex drive well into their later years, but it's a change that many men notice and often worry about. Several factors contribute to this change. Testosterone levels naturally decline with age, which can affect libido. By age 70, a man's testosterone level might be about 30% lower than it was when he was younger. This hormonal shift can lead to a decrease in spontaneous sexual thoughts and a longer time needed to become aroused. Medications can also play a significant role in libido changes. Many common medications for conditions like high blood pressure, depression, or prostate problems can affect sexual desire as a side effect. If you've noticed a sudden drop in libido after starting a new medication, it's worth discussing this with your doctor. Sometimes, alternative medications or dosage adjustments can help. Emotional and psychological factors are equally important. Stress, anxiety, depression, or relationship issues can all impact libido. As we age, we might face new stressors, retirement, health concerns, or changes in our relationships that can affect our interest in sex. So, what can you do to maintain or boost your libido? First, focus on overall health. Regular exercise, a healthy diet, and good sleep habits can all contribute to a healthy sex drive. Exercise, in particular, can boost testosterone levels and improve mood, both of which can enhance libido. Consider exploring mindfulness or meditation techniques. These practices can help reduce stress and anxiety, which often interfere with sexual desire. They can also help you stay present in the moment during sexual activities, enhancing your enjoyment and connection with your partner. Don't underestimate the power of novelty. Try new activities with your partner, both in and out of the bedroom. This could mean exploring new sexual techniques, trying new positions, or even just going on different types of dates. Novelty and excitement can stimulate the production of dopamine, a neurotransmitter associated with pleasure and arousal. Communication with your partner is crucial. Discuss your desires, concerns, and any changes you're experiencing. Sometimes simply talking about sex more openly can increase desire. If you're single, don't assume that means your sex life is over. Many older adults find new partners or explore dating in their later years. If low libido is significantly impacting your life, don't hesitate to seek professional help. A doctor can check for underlying health issues or adjust medications. A sex therapist or counselor can help you work through emotional or relationship issues that might be affecting your desire. Now, let's discuss our fourth topic: changes in sensitivity. Many men find that as they age, they experience changes in genital sensitivity. This can mean needing more intense or prolonged stimulation to achieve arousal or orgasm. These changes are largely due to neurological shifts that occur with aging. Nerve endings may become less sensitive, and the speed of nerve signals can slow down. It's similar to how our taste buds become less sensitive as we age, often leading to a preference for stronger flavors. While these changes are natural, they don't have to diminish your sexual pleasure. In fact, many men find that these changes can lead to a more varied and satisfying sexual experience. The key is to adapt and explore new techniques. One effective approach is to focus on whole-body sensuality. As genital sensitivity decreases, other parts of your body might become more responsive to touch. Explore erogenous zones like the neck, earlobes, inner thighs, or lower back. This can not only increase overall pleasure, but also create a more intimate and connected sexual experience. Experimenting with different types of stimulation can also be helpful. Try varying pressure, speed, and technique during sexual activities. Some men find that vibrators or other sex toys can provide the increased stimulation they need. Don't be shy about incorporating these into your sexual routine. They're tools for pleasure, not replacements for intimacy. Mindfulness techniques can enhance sensitivity by helping you focus on physical sensations. Practice paying close attention to every touch and sensation during sexual activities. This heightened awareness can intensify your experience and counteract some of the physical changes in sensitivity. There are also exercises you can do to potentially improve genital sensitivity. Kegel exercises, which we mentioned earlier for erectile function, can also increase sensation by improving blood flow to the pelvic area. Another technique is sensate focus, where you or your partner slowly caress different parts of your body, focusing on the sensations without any pressure, to become aroused. Remember, these changes in sensitivity don't just affect you. Your partner may be experiencing similar changes. Open communication about what feels good and what doesn't is crucial. This can lead to a mutual exploration that enhances intimacy and sexual satisfaction for both partners. Moving on to our fifth topic, changes in ejaculation. As men age, they often notice changes in both the volume and frequency of ejaculation. The volume of semen typically decreases, and the force of ejaculation may lessen. Some men also find that they need more time between ejaculations to recharge. These changes are primarily due to physical factors. The prostate gland, which produces much of the fluid in semen, tends to shrink with age. Muscle contractions that propel semen during ejaculation may also weaken. Additionally, testosterone levels, which play a role in semen production, naturally decrease with age. It's important to understand that these changes don't necessarily impact sexual pleasure or satisfaction. The intensity of orgasm is more related to muscle contractions and nerve sensations than to the volume of ejaculate. Many men report that their orgasms while different, remain highly pleasurable. For those concerned about ejaculatory control, there are techniques that can help. The stop-start technique involves stimulating the penis until just before the point of ejaculation, then stopping until the urge subsides. This is repeated several times before allowing ejaculation. Over time, this can improve ejaculatory control. Another helpful technique is the squeeze method. This involves squeezing the base of the penis or just below the head when approaching ejaculation. This can help delay orgasm and improve control. Both these techniques require practice and patience, but can be very effective. It's also worth noting that some men experience retrograde ejaculation as they age, especially if they've had prostate surgery. This is when semen enters the bladder instead of exiting through the penis during orgasm. While this doesn't typically cause health problems, it can affect fertility and may be disconcerting if unexpected. If you experience this, it's worth discussing with your doctor to rule out any underlying issues. For overall sexual satisfaction, focus on the entire sexual experience rather than just ejaculation. Explore different forms of stimulation, extend foreplay, and communicate with your partner about what feels good. Remember, sexual pleasure is about the journey, not just the destination. If changes in ejaculation are causing significant distress, or you notice sudden, dramatic changes, it's important to consult with a healthcare provider. Sometimes these changes can be signs of underlying health conditions that need attention. Now, let's delve into our sixth topic: the emotional impact of these sexual changes. It's completely normal to have emotional reactions to the shifts in your sexual function and experience. These might include feelings of loss, anxiety about performance, or concerns about your attractiveness or masculinity. Many men tie their sense of self-worth or masculinity closely to their sexual performance. When that performance changes, it can lead to feelings of inadequacy or depression. It's crucial to recognize these feelings and address them head-on. One helpful approach is to reframe your thinking about these changes. Instead of viewing them as a loss, try to see them as an opportunity for growth and exploration. Your body is inviting you to discover new ways of experiencing pleasure and intimacy. This shift in perspective can transform frustration into curiosity and excitement about new sexual experiences. Practicing self-compassion is also vital. Treat yourself with the same kindness and understanding you would offer a good friend facing similar challenges. Remind yourself that these changes are a normal part of aging, not a reflection of your worth as a person or a partner. Mindfulness techniques can be particularly helpful in managing anxiety about sexual performance. By focusing on the present moment and the sensations you're experiencing, you can reduce worry about performance and increase enjoyment. Start with simple mindfulness exercises like deep breathing or body scans, then gradually apply these techniques to sexual situations. It's also important to address any underlying issues that might be exacerbating emotional distress. Unresolved relationship conflicts, stress from other areas of life, or untreated depression or anxiety can all impact your emotional response to sexual changes. Don't hesitate to seek professional help if you're struggling with these issues. A therapist, particularly one specializing in sex therapy, can provide valuable support and strategies. Communication with your partner is crucial in managing the emotional impact of sexual changes. Many men feel embarrassed or ashamed to discuss these issues, but open, honest communication can strengthen your relationship and lead to mutual understanding and support. Your partner may be experiencing their own changes and concerns, and sharing these experiences can bring you closer together. Remember, your sexuality is just one aspect of who you are. While it's important, it doesn't define your entire worth or identity. Focus on nurturing other aspects of your life, hobbies, friendships, personal growth, to maintain a balanced sense of self-esteem. Now, let's move on to our seventh topic: communication with your partner. Effective communication is the cornerstone of a satisfying sexual relationship, especially as we navigate the changes that come with aging. The first step in good communication is creating a safe, non-judgmental space for honest discussions. Choose a time when you're both relaxed and free from distractions. It might help to start the conversation outside of the bedroom, where there's less pressure or association with sexual performance. When discussing sexual changes or concerns, use I statements to express your feelings without blaming or criticizing. For example, instead of saying, "You don't turn me on anymore," try, "I've noticed some changes in my arousal, and I'd like to explore new ways for us to be intimate." Listen actively to your partner's responses and concerns. They may be experiencing their own changes or worries about sex and aging. Show empathy and validate their feelings, even if their experience differs from yours. Be specific about your needs and desires. If you need more time for arousal, different types of stimulation, or want to try new activities, express these clearly. Encourage your partner to do the same. Remember, your partner isn't a mind reader, and neither are you. It can be helpful to frame discussions in terms of exploration and discovery rather than problems that need solving. For instance, you might say, "I'd love for us to explore new ways of being intimate together," rather than, "We need to fix our sex life." Don't shy away from discussing the emotional aspects of sex and intimacy. Share how the changes you're experiencing make you feel, and ask your partner about their emotional experiences too. This vulnerability can deepen your emotional connection and enhance your physical intimacy. If certain topics feel too difficult to discuss, consider writing letters to each other or using prompts from relationship books or counselors. Sometimes, having a structure can make these conversations easier to navigate. Remember that communication about sex isn't a one-time event. Make it an ongoing dialogue. Regular check-ins about your sexual relationship can help you address issues as they arise and continually adapt to each other's changing needs and desires. If communication remains challenging, don't hesitate to seek help from a couples counselor or sex therapist. They can provide tools and strategies to improve your communication and work through any issues you're facing. Now let's explore our 8th topic, adapting and finding new forms of intimacy. As our bodies change, we have the opportunity to expand our definition of sex and intimacy. This can lead to a richer, more satisfying sexual life than we ever imagined. First, it's important to broaden your view of what constitutes sexual activity. Penetrative sex is just one form of sexual expression. Explore other activities like mutual masturbation, oral sex, or using sex toys together. These can be equally or even more satisfying, especially as sensitivity changes or if erectile difficulties arise. Focus on sensuality and whole-body pleasure. Take time to explore each other's bodies, paying attention to non-genital erogenous zones. This can include massage, gentle touching, or using different textures and temperatures for stimulation. Many couples find that this expanded focus actually enhances their overall sexual experience. Consider incorporating new elements into your sexual routine. This might include role-playing, trying new positions, or exploring fantasies together. The key is to approach these explorations with an open mind and a sense of playfulness. Remember, there's no right way to be intimate. It's about finding what works for you and your partner. Don't underestimate the power of non-sexual intimacy. Cuddling, holding hands, or simply spending quality time together can strengthen your emotional bond and enhance your overall intimacy. These activities also release oxytocin, often called the cuddle hormone, which can increase feelings of bonding and arousal. For some couples, scheduling intimate time can be helpful. While it might seem less spontaneous, having dedicated time for intimacy can reduce performance pressure and allow both partners to fully relax and enjoy the experience. This doesn't mean every encounter needs to lead to sex. It could be time for massage, intimate conversation, or simply being close. Experiment with timing. You might find that your energy levels and arousal patterns have changed. Some men discover that morning is now their best time for sexual activity, while others prefer the relaxed atmosphere of the evening. Be open to adjusting your routine to find what works best for you. Consider exploring tantric practices or mindfulness techniques in your sexual activities. These approaches focus on being present in the moment and can enhance intimacy and pleasure, regardless of physical changes. They often involve breathing exercises, eye contact, and slow, mindful touch. Remember that intimacy isn't just physical. Emotional and intellectual connections are equally important. Engage in activities that stimulate your mind and emotions together. This could be anything from taking a class together to having deep conversations about your hopes and dreams. If physical limitations are impacting your ability to be intimate in familiar ways, be creative in finding solutions. There are many adaptive tools and techniques available, from positioning pillows to specialized furniture designed for sexual activity. Don't hesitate to consult with a sex therapist or occupational therapist for personalized advice. Now, let's move on to our 9th topic: caring for your overall health. Your sexual health is intrinsically linked to your general health, so taking care of your body as a whole is crucial for maintaining sexual function and enjoyment. Regular exercise is one of the most important things you can do for your sexual health. It improves cardiovascular health, increases energy levels, boosts mood, and can even increase testosterone levels. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week, along with strength training exercises at least twice a week. Pay special attention to exercises that strengthen your core and pelvic floor muscles. Kegel exercises, which we mentioned earlier, can improve erectile function and ejaculatory control. You can do these discreetly anytime, anywhere, while watching TV, sitting in traffic, or even during work meetings. A healthy diet is equally important. Focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Some foods are particularly beneficial for sexual health. For example, foods high in flavonoids, like berries, apples, and tea, have been linked to a reduced risk of erectile dysfunction. Omega-3 fatty acids, found in fish like salmon, can improve cardiovascular health and potentially boost libido. Don't underestimate the importance of good sleep. During sleep, testosterone levels naturally rise, and your body repairs and regenerates tissues. Aim for 7 to 9 hours of quality sleep each night. If you're having trouble sleeping, consider establishing a relaxing bedtime routine, limiting screen time before bed, and creating a cool, dark sleeping environment. Managing stress is crucial for sexual health. Chronic stress can lower libido, contribute to erectile difficulties, and decrease overall sexual satisfaction. Find stress reduction techniques that work for you. This might include meditation, yoga, deep breathing exercises, or engaging in hobbies you enjoy. Regular checkups with your healthcare provider are essential. Many health conditions can impact sexual function, including diabetes, heart disease, and hormonal imbalances. Early detection and management of these conditions can help maintain your sexual health. Be open with your doctor about any sexual concerns you have. They're an important resource for addressing these issues. Pay attention to your mental health as well. Depression and anxiety can significantly impact sexual function and desire. If you're struggling with mental health issues, don't hesitate to seek professional help. Treatment can improve both your overall well-being and your sexual health. If you smoke, consider quitting. Smoking can damage blood vessels, reducing blood flow throughout the body, including to the genitals. It can also lower testosterone levels and decrease sperm count. There are many resources available to help you quit. Talk to your doctor about the best approach for you. Limit alcohol consumption. While a small amount of alcohol can help some people relax and reduce inhibitions, excessive drinking can lead to erectile difficulties and decreased sexual satisfaction. If you choose to drink, do so in moderation. Now, let's conclude with our 10th and final topic, the benefits of acceptance. As we've explored throughout this video, aging brings changes to our sexual function and experiences. While it's natural to feel some apprehension about these changes, learning to accept and embrace them can lead to a more fulfilling and satisfying sex life. Acceptance doesn't mean resignation or giving up. Rather, it's about acknowledging reality and choosing to work with it rather than against it. When we accept the changes in our bodies, we open ourselves up to new possibilities and experiences. One of the greatest benefits of acceptance is the reduction of anxiety and stress. When we stop fighting against natural changes and worrying about performing like we did in our youth, we can relax and be more present during intimate moments. This presence often leads to greater enjoyment and satisfaction, both for ourselves and our partners. Acceptance also allows us to redefine what sexuality means to us. As we let go of rigid expectations about how sex should be, we can explore a broader range of intimate experiences. Many men find that this leads to a richer, more varied sex life than they had in their younger years. There's also a profound emotional maturity that comes with accepting our changing sexuality. It requires us to confront our fears about aging and mortality, and in doing so, we often develop a deeper appreciation for life and intimacy. This emotional growth can strengthen our relationships and enhance our overall quality of life. Accepting changes in our sexual function can also lead to improved communication with our partners. When we're honest about our experiences and needs, it creates space for our partners to do the same. This open dialogue can deepen intimacy and lead to more satisfying sexual experiences for both parties. Moreover, acceptance of our changing bodies can boost self-esteem and body image. When we stop judging ourselves against unrealistic standards, we can appreciate our bodies for all they've done and continue to do for us. This positive self-image often translates into greater confidence in the bedroom and in life in general. Another benefit of acceptance is the opportunity for personal growth. As we adapt to changes in our sexuality, we develop resilience, creativity, and problem-solving skills. These qualities serve us well not just in our sex lives, but in all areas of life. It's important to remember that acceptance is a process, not a destination. There may be days when you struggle with the changes you're experiencing, and that's okay. Be patient and kind with yourself as you navigate this journey. As we wrap up our discussion, I want to emphasize that your sexual journey doesn't end. As you age, it evolves. By understanding the changes you're experiencing, communicating openly with your partner, exploring new forms of intimacy, taking care of your overall health, and practicing acceptance, you can continue to have a fulfilling and enjoyable sex life well into your later years. Remember, you're not alone in this experience. Millions of men around the world are on similar journeys. If you're struggling, don't hesitate to reach out for support, whether that's to a trusted friend, a healthcare provider, or a mental health professional. I hope this video has provided you with valuable information and strategies to navigate the changes in male sexuality after 60. Remember, these changes are a normal part of life's journey, and with the right approach, they can lead to new discoveries and deeper intimacy. Thank you for joining me on this exploration of male sexuality in later life. I encourage you to continue learning and exploring. If you found this video helpful, please consider sharing it with others who might benefit. Don't forget to subscribe to our channel for more informative content on health and wellness in later life. Before we end, I'd like to leave you with a final thought. Your sexuality is a vital part of who you are at any age. Embrace it, nurture it, and allow it to evolve. Here's to many more years of intimacy, pleasure, and connection. Thank you for watching, and remember, the best is yet to come.